you start getting medications that get stronger and stronger and stronger, and now you're taking heavy narcotics and your pain is not equally or effectively relieved, then you want to start thinking about being sent to a spine surgeon. You want to make sure that you're not getting addicted without your knowledge to a medicine that's not going to ever provide you long-term relief. In my opinion, narcotics are short-term pain relievers. They're not intended for chronic pain management. There are some conditions that have chronic pain associated with them and may need narcotics, but spine conditions very rarely are one of those conditions. A lot of times there's a structural reason for chronic pain that gets worse and worse and worse. And so it's important that as a patient, you start to look for a structural excuse or explanation for your pain so that you're not trying to band-aid it or mask it with narcotics or perpetual repetitive injections that are ineffective. So it's important that you seek out a spine surgeon if your pain management isn't effective in relieving your pain. You don't want to get addicted to narcotics because even if we identify a structural problem, and I've had many patients who are addicted to narcotics through no fault of their own, they come to me after years of being on narcotics. They were offered multiple injections, they didn't work, but now they're on heavy narcotics and they have a structural problem that needs surgery. The problem is that we then fix the surgical issue. We stabilize the spine. We actually get the spine diffused, but the addiction doesn't go away. That's a problem because what happens is when you're addicted to narcotics, as we start to wean those narcotics, the pain spikes. So you're in a cycle of never-ending pain because as you drop your narcotics, your dependence on the narcotics results in increasing pain. So then what's very common is that doctors will write for more narcotics instead of letting you wean. And it's a little bit of a struggle, and it's definitely easier said than done when you're not the patient. I've never been through that, but I see the long-term negative consequences of being on narcotics. It makes it hard for us to control your pain after surgery. We can give you heavy medications like morphine or Dilaudid, and they're ineffective because you've become addicted. That being said, we still do it and we do our best. It's just a lot more challenging. And then the weaning process has to be kind of forcefully done. You have to force your body to no longer require those narcotics. You want to start releasing your natural pain relieving mechanisms that we have built into our body, your natural endorphins. But you can't do that when you've been suppressing it with narcotics your whole life. So it's a process. That slow tapering eventually takes a lot of patience on the patient's part, and it takes a lot of patience on the pain management doctor's part. And if you get to the right pain doctor, a lot of them will help you through that. That's definitely not a specialty for most spine surgeons, but I do rely on some very, very talented and very, very well-trained pain doctors to help me wean our patients off of narcotics, because the long-term goal is to be on no medications and to not need a surgeon and to not need any doctor of any kind for your back. That's the goal. If you have a doctor who wants to have you as a lifelong patient, you might want to consider switching doctors. You know, the goal of these interventions is to get you back to life, to get you functional again. So you want to look for another doctor if it seems like all they want to do is keep treating you forever for the rest of your life. That's not the goal. It shouldn't be the plan for any doctor treating the spine. The other thing that I want patients to realize is that when it comes to therapy, therapy does have its place. Physical training has its place. Building muscularity, stretching, building, all those things are important, but you have to know when you're actually doing more harm than good. Sometimes therapy creates more damage. And when a disc is unstable and shifting back and forth, sometimes therapy can create more pain and even damage the nerves. So it's important, again, to know when to go see a spine surgeon. And like I said, most spine surgeons that are conscientious will do a thorough workup. They will identify what the sources of pain are. They might even send you for more injections. And the goal is to identify the source of pain so that if we can't get rid of it long-term with conservative measures, now we know the source of pain. We can target the pain, we can identify the structural issue, and we can fix it, hopefully definitively.